everybody that while I'm going to give a, short presentation, this is also a community forum. So you get to jump in, especially you, Hyla, with whatever additions you want to add to what I have to offer. And there's a substance I'm going to be talking about in a bit that, I'd also love some input on. So let me share my screen. Pause. See if I can. Where are we here? Okay. So pain is a huge issue in our society. And apparently this is actually Chronic Pain Awareness Month. So this is why I thought it would be a good time to address acute and chronic pain. I live in West Virginia, which is one of the states most deeply impacted by overprescription of opioid medication and the resulting opioid dependency and addiction crisis and overdose crisis. And of course, one of the reasons why states like West Virginia were ripe to be manipulated around over-prescribing opioid medication is because there's a lot of pain here. There's a lot of coal mining here and other industries that create pain conditions. And there are other parts of the country as well where the different industries also promote pain conditions. And of course, people in pain, we all want relief. I've actually been in pretty significant pain the last couple of months because my SI joint went out and causing referred pain down my leg to my knee. And it's actually been at times impossible for me to walk. So and I've had other pain in my past, so I am being currently reminded as to how dreadful pain can be and how desperately we want relief from it. But it's become very clear that the conventional medical pain relief toolbox is very sadly lacking. And most of the pain relief medications offered are addictive and dangerous or stop working after a short period of time. So I want to offer an introduction to at least part of the toolbox that functional medicine or complementary and alternative medicine and herbal medicine can offer. And I'm going to start by talking about the different sort of categories of pain relief. So we know that a lot of pain, and I want to make a distinction, although I'm not going to go into it right now, between acute pain that is being caused by an acute inflammatory condition, or even a chronic inflammatory condition, or an acute injury versus chronic pain, or sort of central pain, which is more having to do with misfiring or overfiring or imbalances in the brain itself, as opposed to pain that is coming from something physiologically off in the rest of the body. So I want to start by talking about inflammation, because inflammation drives a lot of pain, from, mild pain, just a kind of annoying discomfort, to very acute life disturbing pain, whether it be a migraine or what's happening in my SI joint or severe heartburn or. Okay. But inflammation can also occur after any sort of injury, and it can occur after surgery, where there's actually been acute tissue damage, either unintended or intentional in the case of surgery, but there is sequelae to it. As the tissues heal, there is pain. So, and this pain is mediated by a variety of chemicals, inflammatory chemicals. Now, their job is actually to promote healing and to protect against or get rid of viruses and bacteria and other problem promoting critters. But of course, inflammation can then take on a life of its own and become chronic and no longer useful. But whether it is sort of acute new inflammation or chronic inflammation, there are a number of quite powerful compounds that we want to talk about. And I'd actually like to start with the omega-3 fatty acids and GLA, gamma-linoleic acid. So the omega-3 fatty acids, which include EPA and DHA, are actually precursors to a series of anti-inflammatory brain chemicals called PGE3. Now, we actually have 3 sets of prostaglandins, PGE1, 2, and 3. PGE1, and the precursor is GLA, is anti-inflammatory. PGE2, which is made out of the omega-6 arachidonic acid, is pro-inflammatory. And the omega-3s, made out of your omega-3 fatty acids, such as fish oil, are anti-inflammatory. They work systemically. They also work to reduce neuroinflammation, which matters because in ongoing chronic inflammatory states, we can have inflammation going from the brain down into the body, and from the body into the brain, and it can create these pain states where we have chronic pain after there appears to be a healing of the tissue damage that is along with depression and anxiety and other negative symptoms. And this can actually be like a fire, a wildfire that takes off, like what we just saw in Hawaii, where it starts very small and then it can consume an entire region. Well, the same thing with chronic pain. It can start small and that can consume our entire body. Well, part of this process, I'm not going to go into all the intricate details, have to do with neuroinflammation. So we want to be taking substances that can calm down inflammation in the body, but also the brain. And fish oil is one of those substances that can do it. It has also been shown, along with GLA, to reduce platelet aggregation and can be a bit of a vasodilator, which can certainly help reduce migraines. And research has been shown that this can be helpful with migraines, as well as arthritis and other inflammatory conditions. We really want a good quality product. Brand in this case does matter because dose matters. And so 2 of my favorite brands are Nordic Naturals and Carlson. There's a couple of other good brands out there. Now, other brands might be useful and might be screened, for mercury and all of that, but the dose is so low that you actually have to take an awful lot of pills to get the same effect. With something like Nordic Naturals and their Pro 2000, it's a concentrated enough fish oil that 2 to 4 capsules a day will manage most conditions. Now, if you've had a concussion and you're dealing with post-concussive disorder, which a lot of that is actually neuroinflammation, then some people actually recommend for a short period of time a 15 grams of Nordic Naturals high dose fish oil per day. That would be 5 grams per meal. It is a food, it's an oil, so I recommend it being taken with food to digest it most optimally. A quick story that actually involves pain is some time ago, a wife found me. Her husband had been developed a serious brain injury and post-concussive disorder from the Gulf War. And he had been injured for 30 years. He'd gone to every concussion clinic through the VA in the country, and nobody was able to help him. He'd spent 30 years in bed because if he stood up for more than a minute, he would get sharp, acute stabbing pains in his head, to the point that he would actually collapse and fall down. So he couldn't ever be left alone. And he was fully, completely disabled. Well, I had just read Dr. Lewis's book on fish oil and concussion. I mean, literally like 2 weeks earlier. And I told the wife, I said, look, I don't know much about this, but this is what this book says. And you should probably go directly to the source. But if you want to work with me, this is what this book says. And so the very first thing I did with him, because I was just sort of feeling my way, getting to know him as well as this process, was I recommended 15 grams, 5 grams every meal, 3 meals a day for 7 days. At the end of the 7 days, she got back to me and she says, a miracle has occurred. He can get out of bed and he can stand up for 5 to 10 minutes without the pain hitting. And then it hits, and then he falls down, and then he has to go back to bed. Okay. Well, after 30 years, 10 minutes is a miracle. So I said, well, let's do it for another week. So we kept on adding weeks, and I added a few other anti-inflammatories like turmeric, a few other things. But it was really the fish oil that did it. So we kept adding weeks until we got to 3 months. At the end of the 3 months, this man was able to stay upright for most of the day. He was able to do light chores around the house, and he was able to be left alone for extended periods of time. But I'm not a doctor, and, there's some things that I just don't know. And after 3 months, I said, I don't know the safety of being on this dose of omega-3s long-term. So at this point, I really am going to refer you to the Research Institute, who, can probably give you better advice. But the fact is that a miracle had occurred in this family's life just by following this protocol for 3 months. So I wanted to share that story with you. So that's the omega-3 fatty acids. GLA is also an anti-inflammatory. It's good for skin conditions. It is the precursor to the PGE1, and I use it most for depression rather than for pain. And you can get it from either borage oil or evening primrose oil. So I like starting there. Then we have the herbs, ginger, curcumin, boswellia, which are COX-2 inhibitors. COX-2 is another inflammatory product. And for instance, aspirin and your NSAIDs are COX-2 inhibitors as well. But ginger, curcumin, and boswellia combined together or used separately can be very helpful in reducing the intensity of pain. I don't have stories, so I don't know how well they are useful for very intense inflammation and very intense pain. Some of the rest of you may, and if you have those stories, please share them. But at least for more minor inflammation and pain, or like chronic arthritis and that sort of thing, they can be extremely useful in relieving discomfort. And then we come to the proteolytic enzymes, your individual ones like bromelain, there are others as well. They can be combined. Vitalzyme is one company that has combined them, and so is Wobenzyme N. Now, Wobenzyme N actually adds the bioflavonoid rutin to its list of proteolytic enzymes. Vitalzyme does not. One of the stories from Wobenzyme N, the old stories about it, is that supposedly it was used a lot by your East German athletes in the 1960s, which is what allowed them to walk away with a lot of gold medals during the Olympics, because it reduced inflammation to the point that they were able to overtrain. Now, long term, that was probably not good for them. Short term, it worked. So what these there are tissue changes that occur when there's a lot of chronic pain and tissue damage, and that can make it worse. And so what these proteolytic enzymes do is they kind of dissolve whatever is not useful or of self. I know I'm being general here, but I don't understand all the biochemistry. It can be very, very effective in reducing inflammation when you take them between meals, and you can actually dose them very high. My chiropractor actually wanted me to be taking 50 Wobenzyme N a day. It turned out I couldn't tolerate it because of the rutin, but it can be used very effectively in reducing pain. MSM, which is not listed here, but it is a sulfur product, can also be used to reduce significant pain, and has been used actually by athletes to continue to perform after damage or injury when they really shouldn't be. But in the higher doses, the 20 grams or so, MSM can significantly reduce pain, but it's more pain awareness. We'll get up to that in a minute. Arnica montana, which is a homeopathic remedy, is useful for pains, strains, bruising, and post-operative pain. It can be very effective, taken before and after surgery, to reduce post-operative pain. Going back to the omega-3 fatty acids for a minute, they're also very useful in reducing post-operative pain and swelling, and reducing the need for post-operative pain medicine. There is an assumption out there in the world that the omega-3 fatty acids thin the blood to the point that it can cause out of control postoperative bleeding. So most physicians recommend that people stop their omega-3 intake a couple weeks before surgery. That said, there are other surgeons who, because it is so effective in reducing swelling and inflammation, that they actually recommend it during surgery or post-surgery and have not seen a overbleeding problem. So I'm just going to put that out there, that the common sense, we have to stay away from the omega-3s because of surgery, has been argued against. Now, CBD oil, and I'm actually going to ask Kyla to talk about that a little bit. We want to talk about the whole endocannabinoid system. So the endocannabinoids, as a neurotransmitter system in the brain, among a lot of other things, manage inflammation and manage pain. So a lot of people have found that GLA have found that THC, right? What we've all come to know and love as marijuana, is a very effective pain reliever, and it can be. However, it does have its very addictive side effects, and so we really don't want it to be our first line of defense here. CBD, however, which is one of the cannabinoids from the cannabis plant, does not have the psychoactive properties of THC, but does have some major pain relieving properties, as does another endocannabinoid called PEA, which I can't pronounce. It's palmy something. It has way too many syllables for my brain to remember. Anyway, I will in the future be adding PEA to this slide because there's quite a bit of research on it, and it has a lot of activity throughout the entire body. It has mental health properties. It can reduce depression and anxiety. But for our purposes here, it appears to be a fairly potent anti-inflammatory and pain reliever, both by reducing pain awareness, reducing overglutamate activity, as well as reducing inflammation. I'm actually using it right now in combination with turmeric and 2 ibuprofen a day, and have managed to bring my pain down to, very manageable, barely there. The problem is that I then overdo it and increase my injury and make things worse. But that combination of things is managing my pain and inflammation very, very effectively. So, Hyla, will you jump in, please, and talk a little bit about the endocannabinoid system and CBD, especially in regard to both acute and chronic pain? Because she's our local CBD expert. Are you there, Hyla? Okay, we may have to come back. Oh, yeah, good.
Yeah, I have trouble unmuting. Yeah, the endocannabinoid system has receptors all over the body. The CB2 receptors are in the periphery, CB1 receptors in the brain, and CBD has been remarkable for example, for migraines, which is a difficult situation to handle with regular, with pharmaceuticals for sure. And it's been extremely useful for many people. I've had a lot of reports, and for chronic pain. So, and the intermediary is the endocannabinoid system, which has been hidden in plain sight for many years, and it wasn't really
Understood.
discovered until the 60s, and then more recently, there's more and more research being done. And originally it was more THC that was being looked at, but now there is respectable research on CBD and the importance of the endocannabinoid system as a connector, as a stress reducer, as a communication system among all the systems of the body, hormones, and so on. So we're learning more. I'm not prepared to give a really much more
No, no.
presentation.
And I'm not asking you to. This is great.
But we like it. It's been a great addition to my own armamentarium, both using it personally and using it with patients, using it in withdrawal from psych meds as well.
Thank you, Hyla. Yes, no, the community forum, we're just offering you all tidbits. So that's perfect. Okay, so that's, a little toe dip into natural anti-inflammatories, some of which can be actually really potent. Then there is reducing pain awareness, because sometimes we can't actually, in the moment, reduce the source of the pain. I mean, wounds take time to heal. Sprains and joint issues take time to heal. So sometimes, along with reducing the inflammation, we also just want to get out of pain. So I forgot to mention that I'm also taking DPA with my little anti-inflammatory cocktail. So there are a number of approaches to reducing pain awareness. And of course, our first line of defense is always going to be supporting our mood mediating neurotransmitters. Because whenever we have any sort of stress in the body, and pain is a major stressor, all of the neurotransmitters are called upon to step up and help us cope. But as they step up and help us cope, they're firing themselves, and the body may not always be able to rebuild neurotransmitter quantity in a time-effective manner, so they can become depleted. And there's some things that happen when certain neurotransmitter systems become depleted. So let's look at two of them. One is the endorphin system. Now, we know that the endorphins and the enkephalins are among our pain relievers. Okay, in fact, their receptor sites were named opioid receptor sites or opiate receptor sites in the brain rather than endorphin receptor sites, because, that they're why the opiate drugs work, to relieve pain. But it's relieving the awareness of pain rather than actually healing the source of damage. So as pain continues, both emotional and physical pain, our endorphins can become depleted. They're a little more biochemically complex than some of the other neurotransmitter systems. And we actually need a high protein, well-digested diet over a period of time to allow them to be rebuilt. In the short term, we can use the synthetic amino acid D-phenylalanine. Now, D-phenylalanine was actually synthesized in the laboratory in the late 70s, early 80s by a Dr. Erland Price at the Chicago University School of Medicine. And he developed it to try to reduce the amount of post-operative morphine needed to keep his patients comfortable. I actually don't know how much D-phenylalanine is needed to equate to morphine, or if he actually got that far. So I'm really not experienced with the use of DPA in very, very serious pain. However, less serious pain, minor to moderate pain, dephenylalanine, up to several grams a day, can be extremely effective in reducing the awareness of pain. It actually allows the endorphins to stay in the synapse longer and not be degraded by the enzymes. So it inhibits the enzymes which degrade the endorphins in the synapse. So it is very, very effective in relieving minor to moderate and maybe severe pain, both emotional and physical. Now, the serotonin system also gets depleted through chronic pain. And in fact, there are 3 pain conditions that have been specifically connected to low serotonin levels. And these are migraines, fibromyalgia, and actually TMJ. In research have been connected to low serotonin. But of course, any chronic pain will deplete your serotonin, and reduced serotonin actually makes these pain conditions, increases our sensitivity to them. Pain hurts more. So there's a difference between pain and suffering. And there's a lot of ways to reduce the suffering that is involved with pain, and supporting the serotonin system can actually reduce this suffering that is involved with pain. But it can also directly get to some of the roots of both of TMJ, migraines, some migraines, and fibromyalgia. So, of course, the precursors we use to support the serotonin system are 5-HTP and tryptophan. And then we have other products that reduce substance P. Substance P is the chemical that actually carries the pain signal from the source of injury to the brain. But I've been reading some research on substance P. Dr. Bob Miller is actually doing quite a bit of genetic research around substance P, and it has a lot of activity in the brain and body. But what we're concerned with right now is that it is one of the pain communicators. And so anything that can reduce the activity of substance P will reduce pain awareness. So I mentioned MSM before, but capsaicin, which is one of the chemicals in like hot peppers, reduces substance P as well. This is why we have creams, capsaicin creams for like arthritic joints, because it can actually, it does burn somewhat, and it can use up your substance P and reduce your pain awareness for quite a period of time. Finally, we have your natural muscle relaxers, because tense muscles, so inflammation can cause muscles to tense, but very tense muscles can also cause pain in and of itself, and can also impinge upon nerves and cause nerve pain. So we know that GABA is a natural muscle relaxer. Magnesium, which is not listed here, is a natural muscle relaxer. And then things like wintergreen oil and other essential oils can also relax muscles and relieve pain. Both GABA and valerian can work in the brain to, not valerian, GABA and magnesium can work in the brain to offset the activity of glutamate. Increased glutamate activity can increase central pain and pain sensitization, and the kindling effect that can occur in the brain to cause chronic pain. So both magnesium and GABA can help calm that down, like, calming down the fire. There's other, natural muscle relaxers as well. And there was another homeopathic remedy I wanted to mention here, but it came and it went. So that is my little, very introductory lecture on chronic pain. And I'm wondering if there is, any more information that other people would like to add or share, success stories or questions. This is your turn now. I've had my turn. So Linda, would you like to share something?
I don't know a whole lot, truthfully, but I am very curious. I have a daughter who's in post-COVID syndrome, and she's had tremendous trouble with migraines. So I'm finding all of this really helpful. She has had incredibly what I consider horrible treatments, as neurologists have tried to stop these treatments. Interestingly, some of she's had is mimicking what you talk about with the post-concussive syndrome. She's had some, they call them blood blocks, where they go in with your own blood and try to repair leakage at the base of the spine. She's had she's resistant to having any heavy pain meds because we have a good deal of addiction in our family, and she's really frightened of that.
Sure.
But she's taken a lot of the injectable migraine treatments, none of which have worked. So I'm sort of curious about this, some of the treatments that might be positive for her that would be either CBD based or enzyme based,
Well,
Uh,
a lot of my understanding, and other people may want to jump in here as well, is that some of post-COVID is actually neuroinflammation.
that's what it sounds like. Yeah.
It's the brain fog, the fatigue, the pain. This is all neuroinflammation. Now we know that post-COVID does other stuff as well, right? But and so I would absolutely start with a, fairly significant, let's at least start with 4 grams of the Nordic Naturals fish oil. I really like, can be a little confusing on their website because they've got all sorts of different permutations, but I really like their Pro 2000.
Okay.
Okay. And take at least 4 of those a day, if not really bumping it up way high for a week and seeing what gets better. Would be one place to start.
Yeah, because she is not able to stand, just like you're reporting. She'll walk 200 feet and have to sit down because she's having considerable pain or imbalance. So
yeah, so maybe starting with the 15 grams isn't a bad idea. Now, you could also have one of her doctors order from LabQuest or LabCorp or Quest a essential fatty acid panel, so you can kind of know where the balances of the different fatty acids are. And that's, I didn't know about that test way back when I was working with, this one client of mine. If I had, I might have kept him as a client and just, kept an eye on the lab results. But I wanted somebody else to manage the medical side of this. But you can do that. But I would, if she's not been on fish oil, that's absolutely where I would start with her. And, the PEA, and as Hyla mentioned, the CBD oil,
Yeah,
really impacting the endocannabinoid system will give profound migraine relief as well.
that's great.
So,
That's great to hear.
yeah, yeah,
That's helpful. Thank you.
you're welcome.
Yeah, magnesium is also good for migraine.
Thank you,
See,
Hyla. Yeah. And I would dose that fairly high. What dose would you give, Hyla, for the magnesium?
And which one do you do? I use glycinate malate because that has the most relaxing effect, and probably 4 a day to start.
Like 4 grams,
Like
400 milligrams a day?
Well, they usually usually just how many capsules. Each capsule usually really just has like 125
yeah,
peak of magnesium. So you can go up to like 600 milligrams and more. And if
Mhm.
there's a bowel tolerance issue, which is mostly with magnesium oxide, not so
right.
much with glycinate malate, but you can bump it up and see what happens. But it's
Okay.
really valuable for so many syndromes because it's involved in so many reactions in the body.
Mhm.
That's right.
Thank you.
Thanks, Hyla. Other questions or comments? Or success stories? So many of my students and clients have used dephenylalanine very effectively for both emotional pain. Because you see, when we talk about pain, we think about physical pain, but sometimes emotional pain can become intolerable as well. There was a point in my life, because of all my trauma, that it literally felt like there was a knife in my heart that felt physical, because emotional pain and physical pain actually fire in the same place in the brain. And of course, one can cause physical pain can certainly cause emotional pain. And emotional pain can cause physical pain. So a lot of, some of the chronic pain conditions, such as fibromyalgia, the doctors in the past wanted to say it's all in your head, it's all psychological, there's nothing physiological about it. And maybe with sort of the implication, you're kind of sort of making it up. Well, no, we're not making it up. And psychological and emotional pain, as we know, and especially trauma, can get stored in the nervous system, can impact the immune system, and can actually give rise to physiological changes. We see this in fibromyalgia all the time, as well as nervous system changes. And so some chronic pain conditions are actually derived from post-traumatic stress disorder or somaticized PTSD, where the emotional pain, because it's not being processed adequately, is actually being expressed physiologically. And when this is the case, we need to bring in our whole arsenal, right? All 3 legs of the stool. We need to be working nutritionally, and we need to be working psychologically and spiritually in healing the trauma. So I had a client 20 more years ago now who had ended up being bedridden for 2 years with a combination of RSD, which is a pain condition, and fibromyalgia. She literally could not put any weight on her feet at all. And I would see her every day in her bedroom. And then she finally got well enough to get, she had a 2-story house, her bedroom was on the 2nd floor. They installed a little chairlift on her staircase so she could come down into the living room. And at first she was looking for all the physical pain relief she could find and whatever medication she could find, and it was all physical. But and she really wasn't interested in looking at any possible emotional underliers. So she stopped seeing me and was making her round of doctors. And one of the pain clinics she went to had her assessed by a psychologist. Well, the psychologist did a bunch of tests and met with her, had not really taken the time to develop a relationship with her, met with her and told her that she was deriving significant secondary pain from her secondary gain from her pain, and she really needed to stop it. Well, that made this woman acutely suicidal because her rule in her entire life had been to take care of everybody else and never take care of herself. Well, this was the first time in her life that she'd actually allowed anybody to take care of her. And so she interpreted what the psychologist was saying as, I'm a bad person. But since I have no control over my pain and can't do anything about it and actually need somebody to be taking care of me right now, I think I just need to die. So she became acutely suicidal and fortunately called me up and said, help. And I reframed and reinterpreted the results of her psychological testing to make it something she could actually understand and accept without making her a bad person. And she was ready to get to work. Well, it turned out that she had significant childhood trauma. From she and her siblings huddling together in the basement, dark basement, listening to their father beat up their mother and wondering if they were going to be next, to no boundaries, sort of safety boundaries in the family. So like her brother at one point stole her bicycle and smashed it, and there was no repercussions. So that sort of thing. When she was 11, because she wanted money to buy her own clothes, she became a little newspaper girl and would get up at 5:30 in the morning at the age of 11 in the middle of winter in Colorado and snowstorms, throwing, delivering newspapers on her bicycle, with her parents never ever suggesting that, hey, maybe, she and dad could do it together from a nice warm car. So that sort of thing. And then at 18, she joined a religious cult where, again, she was expected to give her all her money to the cult, but also work for it 24/7. She was a very fine basketball player, but she, of course, overdid it. And she was coaching girls basketball in the church as a young adult. And gradually her body just started saying, enough already. And it was, at first it was gradual, and then it was just, she actually tripped down her stairs and injured herself. And from that point on, she couldn't get out of bed for a couple of years. So we did a combination of everything. We discovered that she was gluten intolerant, and we got her diet where it needed to be. We brought in all the amino acids, we brought in other nutrients, we brought in all the anti-inflammatories, we brought in the dephenylalanine. So we really supported her brain and her body. but we also did a lot of trauma healing. And she was one of the people who does her own between sessions work. She did a lot of her own inner child work and tapping and eye movement. And 2 years later, she was able to get out of bed and cut down her medication to a bare minimum, and has been relatively functioning very well for like 20 years until she re-injured herself at a family event and ended up in serious pain again. It took her a couple months, but then she called me up and said, help. And we started working on the trauma, the rest of the trauma work that she hadn't finished. And that's been very healing for her too. She's written a wonderful book about living with chronic pain from a spiritual perspective. And it's a really wonderful healing journey, although she still is in pain. She's sort of gone through seasons of pain, pain relief, more pain, but this is just because it's layers of healing, right? We heal in layers. And so her story is an amazing mixture of needing physiological support as well as the psychosocial and spiritual healing. So we've been going for about an hour. Hi, Valsa, welcome. And Jeff, any other comments, questions, or stories before we end for the day?
Hey, Christina, sorry I missed the first part. I forgot today was community forum.
That's okay. Glad you're here. And of course, this is recorded and you'll be able to access it in a variety of places, including YouTube. All right. So thank you all. Thank you for being with me. And I will see you next month. Next month, where we actually, it's a little bigger deal in the community forum. We really want to be doing a deeper dive into the fact that scientific research uncovered decades ago the nutrients that the brain needs to function optimally and the symptoms that occur, the mental health symptoms that occur when these nutrients are depleted in the body. And so we're going to talk about that, and we're going to talk about the fact that the psychiatric and medical world has completely ignored this research. And
Right,
so,
Christina, can't wait to hear that.
right, and I'm going to ask you also for some help in putting this together as well. Vols is a great researcher. But this is a time to bring colleagues, to bring clients, to bring colleagues, to bring anybody who has no idea that there's actually been research in this area to come and listen. So we're going to be advertising it a little more intensely than we typically advertise this, to try to, because the goal of my life and the goal of the Academy is to get nutrition part of the mental health and addiction recovery conversation. All right. See you all next month.